Hi, and thank you for watching this video on the Relative Mobile Pain Program. I wanted to go over a few of the details with you. This video is being made specifically for the occupational therapy category. This likely will be the one that you see. There might be other videos that you see for nurses and for other credentials, but this is for occupational therapy or therapists. Wanted to recap a little bit about the program. We operate what's called neurofunctional pain management. This is a treatment category that consists of high pulse electrical therapy, IV hydration therapy, and health coaching. However, as an occupational therapist, you're likely not able to do the IV portion of that. Our traditional nurse category, nurse credentials are doing those IVs, but just want to throw that out there because you'll see the IV mentioned everywhere in our system, but you don't have to do those. The program is still able to be done with just the electrical therapy and the health coaching. So, that being said, the high pulse electrical therapy, many of you already have training on electrical devices like TENS units, things like that. We are using a kilohertz electrical device, and it reaches up to about 10,000 pulses per second, or 10 kilohertz, if you will. It's a high frequency device for neural stimulation. All right, so that is why it works so well for pain. I've been doing this program. I created the neurofunctional pain management program back in 2018 and have been refining it ever since. And we converted it to a mobile program about 2 years ago, and we've been working with different licenses and credentials around the country to expand this program and make it available to those who need it in a home-based mobile setting. So that being said, that is the actual program. It is an 8-week treatment modality. So we're actually treating a patient for 8 weeks, twice a week for an hour each time, and the treatment occurs in their home or their living center. You are welcome to have a physical location if you'd like people to come to you, but that's not necessary. And the mobile program is what is more attractive to people generally, is because they do need us. They do need the actual mobile service most of the time. So we treat about 24 different types of pain, and the most common are neuropathy, back pain, knee pain, joint pain, things like that. Those are the most common ones. People are always looking for treatment for chronic pain. Currently, the issue that people have is that um, it's either moving to narcotics, like if the medications wear off, they move to narcotics, or they are going into surgery, or they're going to do procedures, invasive procedures. So that's very common. You see that all the time. And patients don't want that. So doctors are actively looking for options for them, right? So luckily, our program is reimbursable. So our model is structured so that you are an independent contractor working for our company under the direction of our medical directors. The patients are achieving, or I guess getting, their order signed by their current doctor or through one of our telemed services that we have partnered with, and they will get their order signed, and then you can now conduct those treatments, complete the notes and charting, and our company will bill to Medicare. If the patient is a commercial insurance, will do cash pay self bill. They can pay in advance, and they will submit claims to their own insurance. All right. So in this scenario, it's quite different. Everything we do is reimbursable. So you do have doctors referring for treatment. It's very common to get doctors and practices referring patients to you who need pain treatment because it's reimbursed. So that being said, great program for someone with an occupational therapy license or certification to be able to do this on their own under our medical directors and operate that way. So that being said, the model is designed for us to help you build up a clientele, and the clientele keep coming. So here's how it works. The patient would have an 8-week program with you, twice a week for an hour each time. So that's 16 total events. Our program is extremely successful. We have an 85% success rate or higher in some categories at getting people out of pain. It's very successful in that regard. In the world of pain management, it's pretty phenomenal. So patients get out of pain. They will typically stay out of pain for 3 to 6 months. That's very common. Sometimes it's longer, sometimes it's not, but it's 3 to 6 months is a nice average. And then they'll typically come back and do the 8-week program again. So we'll see patients come back and do this 8-week program cycle every 3 to 6 months. They'll do that year after year after year because this becomes how they manage their chronic pain. This is how they handle it. Like I said, the alternatives, you know what those are, and the patients don't want those. All right, so this becomes what they do for chronic pain management. So, how do you, as an occupational therapist, get started with this? So, we are an independent contractor model. So, you would work with us as an independent contractor, which effectively makes you your own business or own operation. You would set up an LLC. Don't have to have that, but I recommend it for everyone. And then you'll be operating under our medical directors and under our program. We will conduct marketing to get the program started for you. So everyone who comes into our system, we have a dedicated marketing campaign. We'll get patients lining up for them. We will chase the leads and then we will place the patient on your schedule. So if you have an availability schedule, we'll put the patient right on the schedule. The very first visit that you see, the patient it'll be a longer than normal visit. Regular visit's an hour long. First visit's an hour and a half. So that you have time to meet them, greet them, answer questions, and then also, if needed, you can do a telemed right on the spot. A lot of patients don't want to have to jump through the extra hoop of going to find or get their order signed by their current doctor, or get scheduled for a separate visit or telemed with another doctor to get their order signed. Most of the time, you'll be able to get order signed right on the spot, and that's available for most states. We have that telemed service available. So you're there for the very first visit. You get the telemed completed, the orders get signed for the patient right there, and then they move forward into treatment. You would do notes and charting. Takes about three to 4 minutes to do it, and then you submit into our EMR system. We use Charm EMR as our platform for that. Submit that in, go straight into our billing cycle, and all of the work you do is paid as a flat rate. So you get paid for everything you're doing as a flat rate, flat fee model, and you pay at the end of the month for everything. So with Medicare patients, they will be put right on the schedule. For cash pay self bill, those patients will typically go to our closing team and they will handle the financial items, and then they put those patients on your schedule for you to work with after that. So that's how that works. Okay, so how much do you make doing this? Most of the time, in most states, I'm going to say it's between about $100 to $125 per hour treatment event. And the reason why it ranges is because some states the reimbursements are better than other states, depending. So can't always guarantee, what the reimbursements are going to be like. But we do pay a flat fee, so you don't have to worry about what the rates are and if they adjust or change, slightly. We monitor and manage that. But from your perspective, you just conduct the work, treat the patient, keep them out of pain, get paid for the work you do, and move on. If you have access to patients that who need this, absolutely get them in the door, get them going. All right. One of the benefits of our program is that doctors will refer for this. So once you get started, you'll see a lot of referral activity, and that's a very common method of growing. And some of our nurses in our program, they have multiple employees and they have lots of referral activity coming in their way. So we see this happen all the time. A lot of people do see really good referral activity from doctors because doctors need the service. There's not much else they can offer. So you're looking at a patient who is, let's just use $100 as a nice flat range for this, but you got a patient who is getting treated 8 times a month, right? So it's an 8-week program, twice a week for 8 weeks. So 16 total events over 2 months. So effectively 8 times a month. So that patient is worth roughly $100 for you. If you have even just one patient in the program, there's some decent revenue flowing in for the time you spend. Most of the time, you should be able to get a handful of patients in the very first month. We like to try and aim for a full load of patients is 12 patients. So it depends on the area. Sometimes we see that many patients looking for treatment in the very first month with marketing. We had a nurse recently when we turned on marketing. She got 8 booked appointments in the first week. Right. So sometimes it goes quickly. There's people everywhere in chronic pain that need treatment. Right. So you're an independent contractor with us, which means you are responsible for your own equipment and supplies and expenses. So the equipment, we use a Neuromed Matrix PMT mobile device that we have fitted for a mobile model. and it's a bit expensive. And I'll put that out there up front. And a lot of people have a hard time with the cost of this, but it is an expensive device, but it is what actually triggers the reimbursement, allows us to do this program. But it's a $28,000 equipment package. Most of our nurses and therapists around the country get this financed. We have several companies that work with us on this, and the financing typically gets down to in the $600 range. That's very common. So if you remember from before, one patient in treatment should be able to generate enough revenue to cover the cost of the equipment alone, right? So that's the idea here, is that even just one patient is enough to at least cover the cost of equipment, but chances are pretty high that you'll get a lot of patients and get going. 12 patients, you're looking at, 12 patients times 8 treatments a month. That's 96 treatments. If you're averaging 100, that's, roughly 9,600. And if you're getting a little bit more in your state, then you could make over 10,000 a month doing this program with a full load of patients. And then the longer you're in this operation, the more stable that becomes, because patients, again, come back and do this again over and over. And then there's new referrals from doctors and patient-to-patient referrals coming in all the time. So there's a bit of an upfront hurdle to get in with the expense of the equipment, but once you're in, we do the marketing, we get it all going, and the idea is to really get you underway and off to the races, right? So that being said, there are other options for the equipment too. So if the equipment, hopefully you're still watching by this point, if financing is not an option, we do have other ways that we can get this worked out. We got different groups to work with that can potentially provide different versions of this. They can provide some rentals and some other scenarios to help get people underway. So the equipment is expensive, and somehow, someone has to pay for it. And so it's difficult for for too many people to be brought into the program if the equipment's provided in some capacity. So, but we do have lots of options, and some of those options do provide the equipment for people, and that will largely depend on you yourself, your ability to actually succeed in the program, and if some of our equipment funding partners are able to talk with you and understand what you can do to build the program. Sometimes they can actually provide the equipment for people like that. So, don't give up if the funding and the financing and the cost of equipment is a hurdle. Keep working with us. We'll figure out a way to make it work. We've had people working with us for over a year trying to get into the program, and we were able to get them in. Sometimes just a matter of waiting for the right time, and we can get people into the program. So keep trying. If the initial financing doesn't work out, we'll find a way to make it work eventually. So that being said, as an independent contractor, we are structuring this company so that it can grow and so that you can grow. As an independent contractor, you are your own business. You're an entity. That's our agreement is with you and your entity. So as an entity, as a company yourself, you are able to hire your own staff and your own people. So one of the things that a lot of our nurses and therapists find out pretty quickly is that once they're up and going, the patient load becomes overwhelming. 2 or 3, 4 months into this, you might have more patients than you could possibly handle. One office that starts referring patients to you, I mean, a very modest referring office is that could be 1 to 2 patients a month. That's pretty modest. I mean, 1 to 2 patients a week. That's a pretty modest referral flow, especially for like a primary care or internal med office that has thousands of patients. 1 to 2 a week, pretty modest, right? If you are in that situation with a single office referring just a couple of patients a week, they'll overwhelm you after a month or two. Like you can't keep up with the pace because you're maintaining those patients for 8 weeks, right? So you'll have to either hire people to help you or just put those patients on a wait list. So I'll get to you when I can. Dozens of our nurses around the country only do this part-time because they don't want a full-time operation. They don't want to be always busy and stuff, and they don't really need to make a whole lot of money. They just like making part-time revenue. It's better than the pay they get at a hospital or a bedside nursing job. So they like that model. Now, you can absolutely do that. You can come into the program, maintain a part-time load of patients, keep whatever other job you have, or just enjoy a half-time operation with better revenue than normal and not have to stress very much. Or you could get out there and build and grow and build and grow. And you can end up with, 10, 12, 15 employees all out there treating patients all in your area. So either one of those options are possible, and I have seen people succeed in both of those scenarios. I've seen plenty of nurses that only wanted 4 to 6 patients, and that's it. And I've seen some of them that are saying, "I want a team of a dozen nurses out here working for me, and seeing all these patients." And all it takes is, getting started and getting a couple of offices to start referring patients for treatment, and you can absolutely build a nice sized team off of that. And again, these patients will be with you regularly for years and years. So there's a lot of longevity to the operation. So that's the overall program. I understand it's not for everyone, and I get that. Now, so I'm not presenting this as an idea that everyone can do this because it's perfectly easy to get started and you can just jump in and go. But for some people who really want to do this, this is exactly the kind of thing they want to do. Start their own operation, something they can build and grow, makes better than average money, and does something really productive. These patients getting out of pain, it'll be one of the greatest things that you do in your career. We've had it's got to be dozens of nurses and doctors now who have told me that the greatest thing or the most impressive thing they've done in their healthcare career has been to get these chronic pain patients out of pain and see them turn their life around. And we have testimonials and reviews and just stories of all kinds describing the patient's path to get out of pain with this program. It's remarkable. It's exciting to be a part of it. It's exciting to see it grow. And we would love for you to join us on our mission to bring this across the country. We are in approximately 30 states at the moment. Our goal is to be in all 50 states and have approximately 1,000 nurses and therapists operating in this program by the year 2030. So we're on track for that, and we're excited about it. So we'd love for you to join us and be a part of it and get out there and actually help people with chronic pain get out of pain doing something that's healthy and safe, covered by Medicare and commercial insurance, and something that you can do as an excellent revenue stream and business for yourself that can last for years and years. Reach out to me in whatever platform I reached out to you on. It's LinkedIn, Facebook, or any other method. Reach out to me, contact me, book a meeting with me. Let's talk. We can get you into the program. We'll talk the details. Thank you for watching, and we'll see you soon.